Hello, welcome to Chiro-Health SF. This is our eye exercise series to prevent injuries from running and other athletic activities. Some of the conditions that you might be familiar with due to higher impact exercise are lower back pain, strain, sciatica, tingling, numbness, tightness and pain throughout the iliotibial band, shin splints, hamstring strains and sprains, as well as calf spasms or plantar fascitis, which is a condition or spasming or tightening of the band inside the foot. So we would like to show you today how to alleviate those safely, and Dr. Mandel is going to walk us through it. Welcome again, and let's get started.
So the first exercise that Dr. Mazgaloff is showing is for the lumbar spine, the lower back. Notice that she has her leg in a flexed position. This allows a stretch on the lumbar spine muscles so that you get a very good roll, a very good stretch and massage. The next that she'll show is for the gluteal muscles, the piriformis as well. Notice that by keeping the leg up on the opposite foot, we keep the muscles stretched, and then by coming a little bit more laterally, a little bit more to the outside, she can get the insertion of those muscles on the hip itself. Next is the IT band, the iliotibial band. Also at the top portion, there's the TFL, the tensor fasciae lata. That's the muscle portion of the IT band. This is a very, very common issue in runners and bicyclists to have tension, especially outside knee pain, very, very commonly IT band problems. And notice that we're running along the entire length of the thigh on the outer portion. Next, we're going to look at hamstrings. The hamstrings begin right at the base of the glutes and go all the way down to the knee. By putting one leg on top of the other, you're able to give yourself a little bit more pressure. Also notice that Dr. Mazgaloff is keeping both of her feet in a flexed position to maintain that stretch on the hamstrings. By rotating that lower leg in or out, she can get the inner and outer portion of those muscles. Next are the calves, the gastrocnemius, and also the soleus. These muscles are very important in people suffering from plantar fasciitis. Notice that she's using her top foot in order to keep the bottom foot in a stretched position, and she's rotating both in and out in order to maintain contact on those inner and outer portions of the muscles. Moving on to the front, we're going to start with the hip flexors. This is your psoas muscle primarily. The hip flexors are directly in the inguinal crease, and so you want to be at about a 45-degree angle from the roller itself. So in this demonstration, Dr. Mazgaloff is rolling the psoas on the leg that is straight. Next is the quadricep muscle group. They go all the way from the very top of the thigh down to the knee. If you straighten your legs, it's not